Hi there, my name is Alex Blank. I'm one of the physical therapists here at Manual Therapy Specialists in Fairfield, Connecticut. Today we're going to be talking about inflammatory drivers of symptoms that might be presenting during the course of physical therapy, what they feel like, why they might come on, and how we can distinguish them against other symptoms that are out there. So if you're watching this, it's because your therapist thought that it might be helpful to explore or explain some of the things that you're feeling on a deeper level, or maybe it's because you're just curious, but happy to get into the details now. So there are different categories of symptom onset. In other videos, we describe all of these categories in more detail, but today we're going to be talking about what an inflammatory driver feels like in our body and how that might present. So it really begs the question of what is a driver, and you might have heard me talk about this in the other videos, but if we take those categories and we put them in a pie chart, rarely do we see the picture on the left where each one is equally contributing to a symptom. Each one of these has its own nature of onset and why we might be feeling or symptoms might be coming on as a result of a loading deficit or a mechanical issue. However, what we do find is the picture on the right, in that the way that your symptoms are presenting at that moment in time is more akin to one of those categories. So in this video, being that we're talking about an inflammatory driver, we can see that as we try to decipher which interventions are most effective for you, that we might be selecting interventions that are going to address more of the inflammatory nature of things that are presenting. As we go through the course of care and this inflammatory category begins to shrink and your symptoms begin to change, that's when we might jump into a different category and start to choose some different interventions in order to progress you towards the function that you're looking to get back to. So we start to break down what is inflammation, and it's a word that you hear all the time, and it's almost become a redundancy in some way or another. But inflammation is the body's natural response to threat or injury. We tend to overlook that this is a natural response. So when you're injured or something comes on suddenly, it's very normal for the body to respond in kind by stimulating the immune system, bringing on local inflammation, sending cells and other markers to the area of injury so that the body can begin the self-repair process. And this is not just limited to the immune system. Your whole nervous system and endocrine system become involved as well, so that it's a body-wide effort to help with the healing process. There's a lot of debate out there of anti-inflammatories and when they're effective, when they're not effective, and are they blunting this immune response. We'll talk a little bit about that today, but just know that when you have a cut or you have an ankle sprain or something, it's normal to feel sore. It's good to feel sore because it's stimulating the self-repair process. So the issue is when that inflammatory process becomes too limiting. It becomes impactful where the pain is too high, or as we might say in the clinic, things are too hot to effectively move forward. And that's where we can start to become strategic in how do we manage that inflammatory system, or that inflamed system, I should say, so that we can still propagate some forward progress. So during the course of an acute or sudden onset, that's when we might be thinking that the inflammatory system is the driver. When pain doesn't follow one particular pattern, what I mean by that is that everything you do when you're inflamed is going to hurt potentially. So that unlike the mechanical video that we made, it's where there's one particular motion that's, a pain driver. In this instance, it doesn't matter which way you move, you might feel your symptoms. An inflamed system will or can have pain at rest, when you're just kind of lying there and you feel that kind of throbbing. It can indicate that, the inflammation is driving your sources of symptoms, and naturally with movement, as we described above. And another hallmark is that there might be increased heat to the affected area, just because the cellular response is sending a lot of blood to that area so that it can start to heal. We can note that it occurs at an isolated region, as if you fell on in this case, maybe he fell on his shoulder and it's, super inflamed, and the body's working to, self-restore at that area. Or it can come in multiple regions. So when the whole system is inflamed, a good example is like when you're sick and every joint seems to hurt, even your hair seems to hurt. It's almost like the whole system is inflamed because your body's working hard to restore itself back to health and stimulating the immune system in kind. So there are some common misconceptions on either end of the spectrum. So when you're inflamed and the body's really working hard to restore itself, sometimes a natural tendency is to gravitate towards bed rest, that if I just kind of lie down and I let things cool off, that I'll wake up, or I'll get up the next day and feel great because I've given my system adequate rest. In truth, there's a lot to be said about light movement and things that we can help coach you through, but bed rest can actually lead to a prolonged immobility or prolonged senses of soreness, just because you're not flushing out the tissues with movement and light activity. Conversely, sometimes athletes in general feel like they need to just play through the pain, and that more movement will just help them get them back to baseline. But in that instance, naturally, it's preventing the ability for the tissues to adequately rest, and therefore propagating the inflammatory process. So how can we help as physical therapists? First off, as always, screening and diagnosing the injury and kind of helping you decipher what category might be driving this, that you might be presenting with. In the cases of acute inflammation, or let's say someone comes in and they quote unquote threw out their back, or they had a sudden onset of back injury, it's really important in those early phases to just help guide activity. How much activity is helpful, how much is too much. Sometimes just through an honest conversation and a little bit of experimentation, trying to help you find that right threshold for activity. In addition to activity guidance, helping you find positions of rest, so that in between bouts of moderate activity or walking or whatever we decide is helpful for your system, helping you find the right combination of just pillows and support, so that when you are resting, your tissues are in a kind of a neutral position, not putting too much stress and strain on the body in one place or another, so that the restoration process can just continue fluidly. Additionally, we help kind of you decipher whether ice or heat might be helpful. Sometimes it is, sometimes it isn't. In the bouts of acute inflammation where things are really hot, sometimes we stray away from heat because it just brings more blood to the area that isn't able to get effectively pumped out, and ice really is your best bet. And there are times when an anti-inflammatory like Advil or Aleve can just reduce the amount of inflammation in the system enough to just help you move in a way that still flushes the system effectively. And let's not forget that a helpful collaboration with your medical provider in some instances can be really effective. So if someone comes in, again, say too hot or too inflamed, there are times when we might want to consider reaching out to a doctor to help on the medical side. So, all of those decision making elements are just things that we can help you through. When appropriate, manual therapy can be effective. Gauging our pressure appropriately, helping things start to move in a way that helps with blood flow or flushing out the tissues. Um, there are times when we might make a choice that you're really too inflamed for us to really have any lasting benefit. That's when we guide you back towards activity and rest. But there are times when manual therapy can be a helpful agent. And then to follow up, prescribing gentle movements, things that are light activity that you might not think of on your own that we can help point you towards. So the end goal of managing an inflamed system, when that is the driver, is to really just help manage the pain, help get you through this acute window where the body's reacting to whatever injury or event happened. It's really important to understand the path or the plan that will get you to less pain, because if you've ever been in acute pain like that, the window of focus really shrinks and all you can think of is how much pain you're in. So, conversing with us can really help open that lens and see that, this is transient, this is temporary, and that there is a path towards your baseline of wellness. And then, just knowing engaging activity and how much is too much, and dosing your activity appropriately is just, will only help your body's ability to heal. So if you have questions, please, ask your treating therapist, whether that's me, or Dave, or Kate. We'd love to help in any way that we can, and hope this was helpful.